Okay, so I just washed my hands. I had to turn the computer on with this finger. So I'm going to alcohol this finger. Okay, I'll just alcohol everything. This is just for my hands. I need to prep my syringe and prep my antibiotic. To prep your antibiotic, basically all you do is twist and open the valve. To open these valves, they're clipped together like this. You just need to separate these two pieces, pull them apart, basically. It's not really that difficult. I'm just struggling this morning. Okay, so I see it coming through, and I'm going to clip it back down. You see it's, I don't know if you can see that, but it's dripping all over me. Okay, so I'm going to put that down. Antibiotic is ready. Get my saline solution ready. This is the SA part of SASH. The rest goes after you're done with the antibiotic, which would be an hour from now. I was told that those plastic bags that these come in are very sticky and they'll like stick all over your hands again away. So you know, you're supposed to get rid of them pretty soon. Alright, that doesn't want to come out. So I'm gonna prep this. Okay, so this is kind of prepped. Basically prepped. Alcohol everything. Okay. Taking my bad boy out, getting the tape out of the way so it doesn't interfere and it doesn't hold bacteria and then somehow get involved. So you're going to keep this on for 15 seconds. And 1,000. Okay. I like to be super anal and make sure there's no fibers from the alcohol swab, because I don't know. No one said anything about them, but I feel like that's probably not cool in your veins. So, okay. Let's get this party started, shall we? Now the saline solution you do in 3 pumps. Show you what that means in just 1 second. Okay, so this bad boy is pumped, primed, whatever the word is. I'm just gonna push it a little bit to get all the air out, and I see it come up to the surface. If I didn't have this top on, it would squirt out. Of course, I'm not an expert. I literally just learned this yesterday. I kind of want to make sure it's not squirting out. Okay, so just pumping it till it's full at the top. Can you see that? I do that. I'm not sure if you need to do that, but I do that. This is going to go everywhere, by the way, but I don't care. Air bubbles are good. Now, you push and twist. until you can't twist anymore. So it's on there, it's good, it's ready to go. There's another valve here that if you keep pushing and you're like, why isn't it going anywhere? It's so hard to push. It's because this valve's probably closed over here. I have two because the original piece is there. I don't touch this one. I only touch this one. Okay. So I'm going to prop this bad boy open and push. Now what I mean by 3 pushes here is 3 pushes is 10. So I'm just going to break this up into 3 sections. So I'll do like 3 at a time, and then another 3, and then another 3. Alright, so we got, so I'll just push it like this. Can you see that? Oh, so while I'm doing this, let me tell you a story about how I cannot sleep on my back with this stuff. It's like painful. It hurts in my chest. I didn't realize they actually go up to your chest when they shove this thing in you. And they're like, oh, when they were putting the PICC in me, they were like, oh, move your head this way, or whatever. I was like, what? And they're like, yeah, we have to push this through your chest vein or some shit like that. So I was like, okay, but now when I lay flat on my back, it hurts chest like up here. So I have to sleep on my side, and when I sleep on this side, the other side, I end up with knots. I think that's probably a lot of people with chronic fatigue have that. I get like knots all over all the time from doing nothing, and they're painful and they're large, and they kind of like cut off circulation. So I've been like massaging myself, but it really helped. Like it really helped. I massaged the one out of my neck here because it was like hurting all the way down to my finger. It was like pinching a nerve or something. Also, she went to town on me when she put the PICC line in. I thought like, wow, this is just like really suck. And then when the nurse came, she was like, whoa, she did a number on you. And I was like, what? So that was not cool. Okay, so I'm going to show you, I don't know if you can see that. There's like a tiny little air bubble by number 1. I'm going to make sure that I don't push that anywhere near me. And also I'm a little more paranoid about it going here, because if you end up with a suction, it's bad. It's really bad. So I'm going to cut this off. Again, I'm not sure about this part. I always cut it off before I take it off. I don't know if you need to do that. And then twist this off. So you don't go all the way. You don't push until you can't push anymore. You go up to the top. Yeah. And especially like if you see the bubbles at the bottom. I try never to get to the bubbles. Okay, so that's done. Now you remember you got alcohol again. Every time this thing hits air, alcohol. Anytime you're about to do anything with this, alcohol. So another 15 seconds. Yeah. Sometimes I prep all of the syringes at one time. I mean, that's the way she did it, but I have an hour to kill after I set up my antibiotic, so like I just wait until it's getting closer, and then I prep my saline, another saline, and the Heprin, which is in the blue package. Maybe I'll show that to you after I do this. I don't want to do too many things because then your hands get, the chances of them getting infected. So usually right after I right after I alcohol something, I plug it in right away, you know, and then I continue to touch everything with my hands. And maybe I will continue this video if you guys want and do how I take it off. I still have not figured out when the antibiotic stops. I just wait an hour and then cut it off because I'm like, I don't know if it's going through or if it stopped or whatever. I know that's probably the worst thing you could do. I'm not really sure, but I've never been able to tell when it's done. Maybe I just cut it off before it's done. I don't know. But it auto sets itself up, so it's not like it's supposed to take a complete hour. I have no idea. Okay. So this part, you see there's still a little antibiotic coming out from when I prepped it. You're going to push and twist again until you can't twist anymore. Now remember, nothing's going to come out until you open up the valves. So just open up this one, open up this one, this other one. And you should be able to see it kind of moving. I don't know if you can see that. Kind of, do you see the little bubbles going through? That's how you know it's working. Guys, another thing, when you do get your antibiotic, I did this earlier, but I didn't post it. When I take it out of the fridge to defrost it, I double check that my name's on it. I double check the amount, the drug, obviously. Double check the date, the distribute date, and I double check the expiration date. I literally double check everything on this. I mean, I know they all look the same, but you never know because they could have shoved something else in there and accidentally given you the wrong Christmas ball, as I like to call it. So yeah, double check that. And this, I wanted to let you guys know, this is the home pump Eclipse. These are they call them the pumps. They're a little more expensive, but they're a little more foolproof. So you set it, you forget it, you can walk around with it, you can do whatever. I think Dr. Lerner always orders these because the rest of them are like a pain in the ass. So okay, anyway, I'll see you guys in an hour.